How does genetic predisposition affect reproductive cancer risk? Imagine a tiny change in your genes that can influence your chances of developing certain cancers later in life. That's what genetic predisposition is all about. It means some people are born with inherited gene mutations that can increase their risk of reproductive cancers like ovarian, cervical, or testicular cancer. These mutations are passed down from parents and can make someone more likely to develop cancer earlier or more often than the general population. For women, mutations in the BRCA1 and BRCA2 genes are well known for raising the risk of breast and ovarian cancers. Women with these mutations can face up to a 46% chance of developing ovarian cancer in their lifetime, and their risk of breast cancer can be as high as 85%. These mutations follow an autosomal dominant pattern, which means just one copy of the mutated gene from either parent can significantly increase risk. Knowing about these mutations helps doctors recommend personalized screening or preventive options. Another important genetic factor is Lynch syndrome, caused by inherited mutations in DNA mismatch repair genes like MLH1, MSH2, MSH6, and PMS2. Women with Lynch syndrome have a higher chance of developing endometrial or uterine cancer, with lifetime risks reaching 40 to 60%, and ovarian cancer risk around 9 to 12%. These cancers tend to occur at younger ages, sometimes even before menopause, making early detection and management crucial. Family history is a strong clue. If a woman has a mother, sister, or daughter who had ovarian or uterine cancer, her own risk can be 3 to 4 times higher. This clustering of cancers often points to inherited gene mutations rather than just shared lifestyle or environment. Besides BRCA and Lynch syndrome, other genes like CHEK2, 8-HM, Rad51°C, and Rad51D are also linked to increased risks of gynecologic cancers, though their impact is generally smaller. In men, testicular cancer is less strongly associated with inherited mutations, but having a family history can still raise risk. Some genetic conditions may play a role, but the exact genes involved are less clearly understood than for female reproductive cancers. Cervical cancer is mainly caused by persistent infection with high-risk types of human papillomavirus, or HPV. While inherited genetic factors don't directly cause cervical cancer, they can influence how well a person's immune system responds to HPV. Some genetic traits may make it harder for the body to clear the infection, which can increase risk over time. Still, no major hereditary syndromes are linked directly to cervical cancer. Understanding genetic predisposition is vital for prevention and early detection. If someone knows they carry a high-risk mutation, they can work with healthcare providers to develop tailored screening plans, consider preventive surgeries like removing ovaries, or explore other risk reduction strategies. Genetic counseling plays a key role here, helping individuals and families understand their risks and make informed choices. In summary, inherited gene mutations can significantly influence reproductive cancer risk by increasing susceptibility and sometimes leading to earlier onset. Recognizing these genetic factors allows for better prevention, early detection, and personalized care. Always consult healthcare professionals for personalized advice, and remember that genetics is just one piece of the puzzle. Lifestyle, environment, and regular medical checkups are equally important in maintaining health.